what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Do the math. At Oak Mountain Academy, our average graduating class has just 12 students. We celebrate a 100% graduation rate with more than $10.5 million in college scholarships offered. Plus, 96% of our students are accepted into their top choice college. Do the math. Can you see the value of an OMA education? I'm Patrick Uran, head of school at Oak Mountain Academy, and I'm here to help you do the math. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
National headlines and the local stories you care about. WLBB, Carrollton, News Talk, 1330, FM 106.3.
And good morning. Welcome to Community Voice. I'm your host, Josh Engel. This morning's episode with Tanner Health System is going to be live streamed on our WLBB News Talk 1330 Facebook page. So if you have any questions or comments or kudos for our guests, please feel free to do so. We typically, with Tanner Doctors, end up having comments come in, and it's usually, this person is amazing, this person saved my life, this person saved my husband's life, this person caught this early, you know. So we always like to give listeners the opportunity to jump in the chat. You can check out the live stream on the Facebook as well as our Grata Communications YouTube page. Today is Wednesday, March 11th, and my guest, in honor of Colorectal Cancer Awareness Month, is Dr. Watcoun-Nchinda Pisoh. We'll call him Wat Pisoh throughout the show. Limit the opportunities for me to embarrass myself. Watcoun-Nchinda Pisoh, Dr. Watcoun-Nchinda Pisoh, specializes in gastroenterology and hepatology with special interests in inflammatory bowel disease, esophageal disorders, gastrointestinal cancer prevention, interventional endoscopy, if I said that right,
That's right.
And fatty liver disease. He completed his residency in internal medicine at Southern Illinois University, SIU, in Springfield, Illinois, and a fellowship in gastroenterology and hepatology at the University of Illinois College of Medicine, Peoria. Dr. Pisoh served as chief of residence and clinical instructor of internal medicine at SIU. He was also a clinical assistant professor of medicine at the University of Illinois, where he was chief fellow for the gastroenterology, hepatology, and nutrition program. He is also a diplomat of the American Board of Internal Medicine with dual board certifications in internal medicine and gastroenterology. Dr. Pisoh, did I make any mistakes? Did I leave anything out?
That's perfect. Perfect intro.
Awesome. Well, thank you so much for joining us today. I appreciate you coming on the program.
It's my pleasure.
Well, why don't we jump right into it? For those who may not know, what is Colorectal Cancer Awareness Month, and why is it so important?
So, first of all, colorectal cancer is one of the top 3 cancer diagnoses in the U.S. We have about 150,000 people diagnosed every year, with about 50,000 people dying from it every year. And so back in 2000, Congress decided that they were going to educate the population. They were going to find a way to attract attention to this and get more people screened. And so they instituted March as the Colorectal Awareness Month. And I think it's Bill Clinton who signed it into law or something. And since then, every March, all the GI societies, gastroenterologies, cancer societies start a health campaign to get the population, aware of this problem, and particularly to get people screened, because this is one of the cancers that's preventable. We can do a lot of things to prevent it. In fact, of the top 3 cancers I mentioned, so breast cancer, prostate cancer, and colon cancer, this is the one that is truly preventable, where we can find pre-malignant lesions. Pre-malignant means that things that are not yet cancer but can turn to cancer, we can find them and take them out, and that way people don't get cancer. All the other cancers have to are basically detecting early cancer. So it's already cancer, and you're trying to find it early. But the difference here is with colorectal cancer, you're trying to find the pre-cancer lesion. And so it's an exciting time for us. I'm here today to try to get West Georgians aware of this problem and get them screened.
Get up to date, get aware. I mean, it's shocking to think, I mean, that this was such a national, a widespread issue that it made it all the way up to the president. I mean, it was discussed, at this national level. So not to put you on the spot, but since the implementation of this awareness campaign, Colorectal Cancer Awareness Month, can you speak at all to the impact that may have had on mortality rate? Has that gone down, or have other factors kind of canceled that out, or?
Yeah, so there's been a dramatic impact with this. Colorectal cancer, especially in people older than 50, is one of the cancers with mortality is actually dropping for those older than 50. And a lot of this has been attributed to our screening programs, especially with colonoscopies. The campaign has led to, I remember back when I was in training, I think the uptake rate in the U.S. in general was around 40% for colonoscopies. Now the national average is 60%, wow. About 60%. Georgia is around 50-something percent. West Georgia is doing really well. It's around 65%. And
shout out to Tanner Health System.
Yeah, absolutely. I give kudos to my partners, my colleagues.
West Georgia gastroenterology, right?
Absolutely. So it has had a huge impact with reducing the mortality, which is really what our target is, reducing mortality of colorectal cancer. Now, the little caveat here is that now we're talking about younger people. So we have now found that the incidence of colon cancer is going up in people younger than 50, the 35 to 50 age group, and I think we'll talk about that later on. But there's a lot of factors that account to that. Now, we're part of this awareness campaign is also getting people aware of the risk factors, and also other ways to sort of prevent colon cancer.
Keeping folks informed, filling it in. I mean, I know there are always meta factors to how this data is collected. It's like in some cases you'll get a better equipment, so that means you catch more cases. Like as you were discussing, like the cells or the lesions, like you're spotting them early. But I mean, it's trippy to think about it moving into that younger audience. But like you said, we'll talk about that here in a second. I'd kind of like to, expand a bit on what causes and whatnot. Before we jump to that, are there any myths or common misconceptions about colorectal cancer that you wish would just disappear out the gate? Before we even get to, people have. Everyone wants to think they're a doctor. They're like, well. Right. So, what are some misconceptions people have?
So there's quite a few. The common one is that if I don't feel it, then I don't have it. Now
very scientific.
Exactly. If I don't feel it, I don't have it. But up to 50% or more in some data sets of patients with colon cancer are asymptomatic. Wow. The other one is, it's only for the older people, so 70s, 80s, that's who should worry about colon cancer. But as I mentioned, we're seeing colon cancer, and I just diagnosed a patient at 32 with colon cancer. So it can affect younger people too. And the younger people have a more aggressive variant of it. The other misconception is that screening is painful. It's high risk, and I don't need to be messing with that, right? But that's also not true. We've really evolved to where colonoscopies are now, it's hard to say, but comfortable.
That's what I hear. Like, people keep saying this, and I never would have imagined. I was one of those ignorant people. I was like, oh, it must just be terrible, like groggy, all the medicine and the process. No, everyone I talk to that's like, oh no, they're tremendous. It's like a spa treatment. You know what I mean? It's like you feel rested and happy and comfortable, and you have the peace of mind.
Absolutely. And for those that, absolutely would not have a colonoscopy, I'll talk about that a bit more. But for those that do not absolutely want to have a colonoscopy, there are other ways of screening. They're less efficacious, but, there's still something. So,
well, before we jump to that first break, let's just establish out the gate, who is most at risk for colorectal cancer?
So the average American has a 5% lifetime risk for colon cancer. So the risk is established for everybody, and then people that have a family history also have a higher risk. Risk is double the average risk. And then there's certain comorbidities, so certain medical problems that people would have that increase their risks. So like obesity, like people who will drink a lot of alcohol, people who smoke, those are diabetes. Those are, patient populations that probably should be screening. And of course, those that have certain genetic abnormalities.
At what age should people start, considering getting screenings?
So a few years ago, that age was brought down to 45. It used to be 50. But with the recognition that younger people are getting colon cancer early, that age is kind of a compromise age. I think in a few years it's going to go down to 40. I think there's a country, I think it's Austria, where they've dropped theirs to 40 now. But 45 is the age that's recommended for colon cancer screening. If you have a family history, it starts at 40, or 10 years younger than the age at which the family member was diagnosed. Now, for other people that have certain genetic abnormalities like Lynch syndrome or APC, those are specific problems. They tend to start screening pretty early, like at 20, 25.
Excellent. So, I'll tell you what. Time is 8:41. Let's go ahead and knock out that first commercial break, and when we come back, I'm going to continue on this line of questioning, discussing, persons who are at risk. We can expand a bit on the colorectal cancer rising in adults, what's going on there, and talk about symptoms you want to keep an eye out for. Of course, talk more about colonoscopies and so much more. So stick with us as we continue our conversation with Dr. Watcoun-Nchinda Pisoh as we discuss Colorectal Cancer Awareness Month. Stick with us.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy specializes in a customized designed academic approach tailored to meet the needs of our families. Our lower division prepares students with the necessary foundation to build excellence. Our middle division provides students with over 15 course offerings, providing them with opportunities to explore their talents and gifts. Our upper division provides personalized academic journeys, allowing them to achieve their dreams. I'm Patrick Uran, head of school, inviting you to journey with us. For more information, visit us at oakmountain.us, where every path leads to purpose.
And we're back to Community Voice. Today's Wednesday, March 11th. If you're just tuning in, be sure to check out the full podcast of this episode or the live stream on our WLBB News Talk 1330 Facebook page or our Graded Communications YouTube page so you can hear the full conversation with Dr. Watcoun-Nchinda Pisoh as we discuss Colorectal Cancer Awareness Month. This is an awareness campaign that kicked off, I think, in the Clinton administration, as we were discussing earlier.
2000. Mm-hmm.
About 2000 to address the rise in cases of colorectal cancer, as well as individuals younger and younger showing signs of that. We'll jump right back into it. We've heard, as you discussed earlier, that colorectal cancer is rising in younger adults. What's that about?
So the specific reason is not known, but it seems to be a number of contributing factors, multiple things that come together to result in that. One of them is obesity. Obesity has been rising around the world, actually, and obesity is a risk factor for colon cancer. Younger and younger people are getting obese pretty early. Maternal obesity even is a risk factor. So if a mother is obese when she's pregnant, the child does have a higher risk for colon cancer. The second thing is diet. More and more we're going for the easy food, fast foods and processed foods, and those. One more thing: early antibiotics, indiscriminate use of antibiotics early. So those things combine to change the microbiome. Explain what that is. Basically, it's our gut bacteria. We're really half bacteria as humans, right? And a lot of that is in the gastrointestinal tract. So changing that bacterial diversity, so to speak, would cause inflammation of the bowels. And the inflammation of the bowels, with chronic inflammation, you start damaging DNA in the cells of the colon, and that's what triggers this abnormal growth that eventually leads to cancer. There's a concept called this may be too detailed, but the cohort effect. So every next generation has a higher risk than the current generation. And that's because I think this obesity, poor diet,
microplastics and chemicals.
Exactly, exercise problems with, our kids are more sedentary now than when we were younger. And so all those things contribute to a higher risk of DNA damage in the colon, and then therefore higher risk for colon cancer.
Well, before we jump into, kind of breaking down the colonoscopic, I don't know if that's a word, but the colonoscopy process, and get to some of the comments that have come in our live stream, are there any symptoms that should never be ignored? If you're feeling something, what should you pay attention to?
So the mantra is, if it's brown, flush it. If it's red, call me.
Yes.
So
there we go.
Yeah. So if you see blood in your stools, don't ignore it.
Okay.
Have it checked out. If you have abdominal pain that's unexpected, so you didn't get punched, you didn't fall, abdominal pain that's not going away, you should get it checked out. If you have a change in your bowel habits, say you were, every day, every morning kind of person, and now you're not going for days, or you're going too much, have it checked out.
Something to pay attention to.
Absolutely. If you have weight loss that you cannot explain, you are not on a diet program, you're eating the same, and you're losing weight, you should have it checked out.
Because let's be real, with the quality of food in general, you ain't going to be losing weight if you're not working out, so that may be a sign of something.
Right.
So, let's jump into the colonoscopy process. We've had some comments roll in from Eric Humphreys. He had asked if we could possibly, just touch on diverticulitis, that it's very important in older adults. And then he commented that colonoscopies are extremely easy, except for the prep, which we'll get into here in a second. And he also left off with Pisoh is a great doctor, one of the absolute best, highly recommended. I told you, someone comes in and says some sweet stuff every time, because you guys are serving the community. That. So. Yeah. They have this one-on-one interaction. So if you could maybe comment on diverticulitis, and then we'll get into the colonoscopy process. So
a diverticulosis is basically a complication of high pressure in the colon. So where you have those pockets is where is the areas of weakness on the wall in the colon. Mm-hmm. That's where blood vessels come through. It's pretty common, especially the older you get. And it's I say complication because it's a result of we think low fiber in our diet. We're eating less and less fiber material in our diet. And diverticulitis is when that diverticulosis gets infected, okay, where there's so much pressure in there that you get an ulcer there and it gets infected. There's a 1 to 2% association with colon cancer. And so whenever you have diverticulitis, we always want to go in and check it out and make sure that the cause is not a growth in that area of diverticulosis.
Excellent. Thank you for that. Thank you for that information. So, and there you go, Eric. Got a little feedback on you for in regards to diverticulitis and diverticulosis. So the colonoscopy process.
Yeah.
I won't even hit you with a bunch of questions. If you could just take us through the process, is from the prep to the end there, is the prep really that difficult? Is it a lot?
I'm going to be honest. It's difficult. It's not the best. It's not a recreational.
Yeah, you're not doing it for fun.
No. So, the process starts with you deciding to do it, whether urged by your doctor or by your family members, or by listening to this show, for example. You decide to do it. You call your healthcare system and say, okay, I want to get screened. And you will get ordered a prep. So there is, in the past, what was really difficult about is we had this large 4-liter prep that you had to chug down really quickly in a short amount of time to get cleaned out. We've since moved away from that. We now have a small volume preps. So small would be 36 ounce or 1 liter preps that we do in a split fashion. So you do 36 hours and then you wait maybe 6 to 8 hours and do the second one. So it's easier to handle that way. And then we also have pills, tablets. So if you're not into drinking horrible tasting liquids, you can swallow pills, right? You can do 12. It's 12 tablets, and then you chase it with water. Two cups of water every 30 minutes. So you drink it over an hour and a half. So that's more acceptable, right? Sure. And you do it in a split fashion as well. And those actually get better results than the old preps we used to have. Now, so it's not perfect, but we've come a long ways, much, much better.
Our grandparents are angry. They're like, I had to chug 6 gallons.
I hear that all the time.
Now
this prep was much better than what I had 10 years ago, So after you do your prep and you come in, you get checked in, you get an IV and all that stuff. We roll you back. There's always a lot of staff members there. We have at least 3 or 4 people in the room taking care of you and making sure that you're safe. I know safety is a concern for many patients, but you have a lot of people that are skilled in the room making sure that you're safe. You come in, you get all kinds of monitors, a monitor for your heart, monitor for your breathing, and then you get sedation. You get medicine that puts you to sleep. It's not always anesthesia. Some people that are higher risk need anesthesia, but for most patients, you get sleeping medicine. People call it Michael Jackson medicine, right?
Oh, yeah, sure.
So it's short acting. It puts you to sleep, and we do our procedure. Usually takes anywhere from 10 to 15 or 20 minutes, depending on what we're doing. And you're totally comfortable. You wake up, and some grogginess afterwards, but not a lot of lasting side effects from it. So it's not, I don't want to call it a spa treatment, but it's close to that.
It might just be our boss that says that. Thankfully, you guys take great care of him, so he's very appreciative, that it goes smoothly. But this is an opportunity for you and the skilled team to get a better look at what's going on in there.
Absolutely.
To see if there's any of the lesions you were talking about.
And I wanted to stress this too, is that our reason for doing a colonoscopy is to look for pre-malignant lesions. We're not going there to look for cancer. Now, of course, we find cancer sometimes, but most times we're going to look for pre-malignant lesions. And the advantage with the colonoscopy is that we can actually take those lesions out. Wow. So when at the end of my day, after doing so many colonoscopies, I can say that with the polyps I took out, I did save a patient from getting colon cancer.
So, and before we take that last break to hear from our sponsors, are there any other screening styles of screening that people should be aware of other than the colonoscopy?
Yes, there are. There's what's called a Cologuard. Is basically it's a blood test and a DNA test combined. It does have an accuracy for or sensitivity for detecting colon cancer, so colon cancer of about 80-something%, but a lower accuracy for detecting pre-malignant polyps, pre-malignant lesions before cancer of about 50%. If you compare that to a colonoscopy, which is about 85% for pre-malignant lesions and 95% for colon cancer. We also have a blood test, a stool-based blood test. It's called a FIT test. it has even lower efficacy rates, and we don't use that too often. And then there's a new one, a kid on the block, the blood tests. You just get a blood draw, they send it out, and they test for abnormal DNA. It has a high sensitivity for detecting colon cancer of 80-something%, but it's terrible for premalignant lesions. It's about 13-15% for detecting premalignant lesions, and it has a very high false positive rate of about 15%. So it would detect abnormal DNA that has no relationship with colon cancer.
So it's still a work in progress. Like they're still kind of refining it. It's still a work in progress, but we actually discourage people from doing the blood test. I mean, it's easy. You can just go get a blood draw, but it causes a lot of, for the patients I've seen that have come in with that, have a lot of anxiety about it. Ooh. And a lot of times I don't really find anything, especially with the older folks, because they're going to have those abnormal DNAs that don't mean anything. Yeah, just entropy. Right. This is just something that will be caught.
However, if you're not going to do anything, you can at least do that one.
At least do that. And real quick, what are survival rates? What are they like when colorectal cancer is caught early? I imagine it's pretty good.
It's pretty good. So, and it's gotten much, much better, but it's upwards of 90% at 5-year survival rate if you're able to detect it early. That's almost as good as anything can be.
Excellent. Well, we're going to go ahead and knock out that last commercial break, but when we come back, we will wrap up our conversation with Dr. Pisoh as we discuss Colorectal Cancer Awareness Month. We'll leave you with some tips, calls to action, prevention, and lifestyle choices that you might want to keep in mind. Stick with us. Community Voice brought to you by Tanner Health and Oak Mountain Academy.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy is a vibrant community built on innovation, academic excellence, and a 64-year legacy of shaping community leaders. I'm Patrick Uran, head of school at Oak Mountain Academy, inviting you to visit the mountain and experience firsthand the passion, purpose, and personalized education that defines our school. Come see how our mission and vision come to life each day. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
And we're back to Community Voice. We're back with Dr. Pisoh as we discuss Colorectal Cancer Awareness Month. We only have about 3 minutes left. So we've established causes, we've established symptoms, we've established who's at risk, and we've gone through the colonoscopy process as well as the other types of testing that's available. In the time we have left, could you please provide folks with advice, counsel, as to how they should move forward in regards to diet, how they want to look out to help preventative measures, and then maybe we can leave folks with where they can learn more and how they can reach out to y'all, of course.
Absolutely. So we've established that getting screened is the best way to prevent this. Now, in terms of lifestyle, because this is actually partly a lifestyle issue. So, and I like to keep this really simple. So, I mentioned that foods that are high in sugars, foods that are low in fiber, processed meat, and processed foods in general tend to have a higher risk for, or confer a higher risk for colon cancer. And so, in terms of diet, you want to try to stick with things that don't come in a can. So less processed food, more fruits and vegetables. Actually, those things feed your colon and keep you healthy, if not only for cardiovascular health, also to prevent colon cancer. The other thing people should keep in mind is exercise. Exercise does play, or being active does play an important role. So we talk of 7.5 METs. That's really just a brisk walking for 30 minutes 5 times a day, 5 times a week. Doing that does reduce risk for cancer by about 20%.
Wow.
So diet and exercise are really important. Now, of course, the other things like quitting smoking, be careful how much you drink. You want to limit how much you drink because those confer risk. And if you have a family history, you want to actually go talk to a provider or health facility to get screened. And I think we will prevent colon cancer as a community. It's not just me and my colleagues that do this. It's also in your families. Kids should talk to their parents. Hey, did you get screened? Because when you get colon cancer, I've seen this. I've had this conversation so many times. It's devastating for the family, and so the spouses, the friends, the colleagues should talk to have that conversation among themselves and try to get in and get screened.
Dr. Pisoh, thank you so much for coming on the program today. If you're due for a screening, take action today. Visit Tanner.org/direct-access to schedule your direct access colonoscopy. No referral required. Dr. Pisoh, thank you so much.
Thank you. It's my
and
pleasure.
Thank you to everyone who tuned in with us at home. We'll see you next time.